Welcome and thank you for being with us today. I'm Braulio Rosa, Executive Director of the Broward County Bar Association. I have the honor and privilege of having Jasmin Shirley with us here today, who's going to give some background on the legacy of African American doctors, founders of the first Black hospital in Broward. And so I'm thrilled to be here with you, Jasmin.
Thank you, and I'm thrilled to be with you as well for such a wonderful occasion. Thank you very much for the invitation.
Perfect. So Jasmin, can you just briefly give us a little bit on your background? Because I know you're a retired medical professional, but can you just give us a little bit on that?
Sure thing. I retired as a healthcare administrator after 17 years with Broward Health, which is the North Broward Hospital District that does business as Broward Health. I was their senior VP of Community Health Services, and Community Health Services had all of the opportunities of business and business ventures outside of an inpatient hospital stay. And such businesses were involved with the ambulatory care facilities, whether they be physician practices or the community health centers, home health and hospice, infusion company, anything on the outpatient arena of the North Broward Hospital District's operations. Prior to that, my background in medical training is in infectious disease epidemiology, and I served Broward County Health Department as the senior epidemiologist during the early 80s through 96. And during that time, the pandemic that we were experiencing at that point in Broward was the HIV/AIDS epidemic. And I had the distinct pleasure of working with some of the firsts around the country to establish Broward County's first ambulatory outpatient arena for HIV care and treatment in an outpatient setting here in Broward County. We did that by co-founding and operating the actual Northwest Health Center, which was one of the health department facilities right off Sistrunk Boulevard and 15th Way, which was the very first opportunity where Broward County had its residents' ability to be able to get their total comprehensive care and supportive services for those who were diagnosed with HIV/AIDS and impacted, and their families for getting their care there. We were one of 9 in the nation at that time. And 42 years later now, HIV is still an epidemic, still impacting our citizens here in Broward as well. So from my arena with epidemiology, infectious diseases, and administration background, I then had the opportunity to begin to establish and work with Broward Health in operating its community health centers and continuing that legacy of outpatient medical care in Broward County.
Wow, very accomplished. The right person to talk to us a little bit about the legacies of the founding doctors of Provident Hospital. And my understanding it's Dr. Mizell, Dr. Shirley, Sistrunk, Morris, and Browns. So can you tell us a little bit about them and about the hospital itself?
Sure thing. We'll first start off with Dr. James Franklin Sistrunk, a very, very, very important man in our healthcare delivery systems here in the early days. He was actually the second physician to come to Broward County, but he's given the privilege and the honor of being the first because he was the one who stayed. He actually came through here in 22, he and his wife from the Dunellen area. And he was actually by medical training, a surgeon. But as many physicians in the early days, especially the firsts, even though they may have been trained in a specialty, many of them worked as primary care physicians or family medicine physicians because our community in particular was very lacking in Black physicians. And so they had to do everything. And so Dr. Sistrunk came to Fort Lauderdale area with his family in the early 20s, 2021, 22, actually. And he began to see the people throughout Broward County as the one physician who stayed, Black physician who stayed. He made lots of house calls, delivered babies, even though he was a surgeon by training. In 1938 or 37, Dr. Von Delaney Mizell, who was actually from Broward County, his family moved to Broward County when he was a child. And then he returned after medical school. And both of these men, Dr. Sistrunk and Dr. Mizell, were Meharry medical student graduates from their medical school training. And he also, a surgeon, came back to Broward County, familiar with Broward County, and he and Dr. Sistrunk formed a partnership together whereby they were delivering care in the Broward County area. Two different kinds of personalities. Dr. Sistrunk, very mild mannered, didn't want to cause a lot of trouble, was not activist oriented, just wanted to serve the people and provide quality care. Dr. Von Delaney Mizell, on the other hand, very, very activist in nature, very progressive in his thinking and visionary. And so the two of them came together and they decided to co-found together Provident Hospital in 1938. Provident Hospital started out on 1409 Sistrunk Boulevard, Northwest 6th Street. It's now called Sistrunk Boulevard, as a 15-bed hospital. Eventually, over the years, until its closing in the mid to late 60s, got up to a 50-bed hospital. But they were known for quality care and for excellence in nursing. And as we all know, nurses are the one, in my opinion, are the backbone of any hospital and the delivery of care out of that hospital, because it's the nursing care that gives you the positive outcomes for the patients who are receiving the care as ordered by their physicians. But these doctors were very progressive and very visionary. With them also at the very beginning was another doctor, and he's not a physician, he was the first Black dentist, who was very instrumental in the co-founding and getting the funding together and what have you with others in the community, Miss Aldridge and other women organizations in the community at that time, to get Provident Hospital up and running in actually late February, March of 1938. So that was Dr. James Linwood Bass. He's a dentist, the first Black dentist. So you had three of the original, what we call the Fabulous Five. Then there was Dr. Richard L. Brown. He was a pediatrician. So you had Dr. Sistrunk, Dr. Mizell, Dr. Bass, a dentist, and then Dr. Brown, a pediatrician, who came on board, and that provided then the care for children in that same hospital. And then so now you can look at them as developing their own multi-practice, but within their hospital setting and their offices as well. In 1949, my father, Dr. Calvin Hilton Shirley, came to Broward County. He was on his way actually to Key West in November of 1949 to visit and probably set up practice down in Key West, but had a accidental stopover in Broward County, had met the three of the doctors, well, the two doctors, physicians, and Dr. Bass. And they told him that when he finished his boards to come on back to Broward County at Provident, and that they would give him a job. So he came back in November of 1949. My dad was obstetrician gynecologist. So now we have the two surgeons in Dr. Sistrunk, Dr. Mizell. We have the pediatrician, Dr. Brown, my dad, OBGYN. So we got a full a full cadre of specialties that could really take care of and the practice of medicine here in the early days of Broward County and within Provident Hospital. One of the things that Provident was known for, as I said, was excellence in nursing care. So much so, all of its nurses, the original nurses in Broward County at Provident, were all registered nurses and BS degree prepared registered nurses. They were the best. I can give you such names as Cora Coleman, who served as the director of nursing at one point. Miss Joanna Bradley, who was a very well-known midwife. Jeanette Shirley, my mother. Cora Eves Brainan, who was instrumental in as a nurse at Provident, as well as the first Black nurse to be at the Broward County Health Department. Later became a commissioner for North Broward Hospital District. So when I say nursing care was quality and excellence in nursing care at Provident, it was because of women like these women who ensured that the nursing care was delivered. There was the quality of quality nursing care. In particular, when I say progressive people and thinking in the early days, believe it or not, the first nursing education program in the whole of Broward County started at Provident Hospital. My mother, Jeanette Lindsay Shirley, developed the curriculum for the nursing education program. Their goal was to develop their own nursing and therefore expand their staff as the hospital grew and the patients grew and the beds began to grow by this time, because Provident went from 15 beds to 25 beds to then 50 beds, that they would have the excellence in nurses even if they had to train them themselves. And so that nursing education program started out. Provident Hospital provided the clinical rotations for the nursing students, and Dillard High School, which also had a community program, a community school program at that time, had the educational component of the nursing program at Dillard High School. My mom taught that program beginning 1960, and that program is still in operation today. It was eventually taken over by the school system and put into the vocational programs and has been operating in the following settings: Sheridan Vocational, McFadder, and Atlantic Vocational since the 1960s. It was always a pleasure for me that when I saw the number of women, Black, white, Hispanic, you name it, who came through that program in the very beginning from the 1960 on, and they would say, "Your name, Jasmin Shirley, do you know a Miss Jeanette Shirley?" And I would say, "Yes, that was my mother." And they would tell me about that program and how she was the nurse's nurse and the best nursing instructor, and encourage them to move forward after they got their license as a practical nurse to go back to school, continue with their educational pursuits, get their bachelor's, get their master's, and go on to be the best nurses that anyone could have caring for them, even if they had to become the nurses who actually became the CEOs of hospitals. And it was a pleasure to meet those women as well. So Provident has a history of excellence. Provident has a history of progressive foresight and vision. And Provident was a major economic engine along Sister Boulevard, then called 6th Street, for the Northwest Black community in particular. Everything revolved around the economic engine. Provident employed over 100 people, was one of the largest providers or largest employers on 6th Street. Businesses along that time, Sister Boulevard, 6th Street was a vibrant business community at that time. And it's amazing the difficulties that we call them the Fabulous Five went through to actually get credentialed to the other hospitals here at that time. Broward General was called Broward General Hospital at that time here in Broward County. Difficulties that they had with getting credentialed at that time. That was a 22-year legal battle for those physicians. Thank God by 1959, when Dr. Morris came into town, Dr. William Morris, the newest, so we'll now add the sixth of, well, so not only do we have the Fabulous Five, but now we have the younger one coming in, Dr. Morris. And my hat goes off to Dr. Morris, because when Dr. Morris came in 1959, and he was a young doctor and he brought his family with him. Yeah, I became on one of the staff positions at Provident Hospital, working with Dr. Mizell, and he, by training and medical profession, his specialty was family medicine. Very, very, very good doctor as well. And it was decided by the docs, by the physicians, that in order to pursue and to try to do what they needed to do to get this fight on, so that they could get the privileges that they needed to get at Broward General, and that their patients would have access to the resources that Broward General could also offer. And because, in those days, Broward County, as other areas throughout Florida and the nation, were segregated. And that was not unusual to have that kind of fight here in Broward County. Unfortunately, that led to a court battle to get their privileges. Unlike other areas in South Florida, Jackson Memorial Hospital did not go through court battles. The Black physicians there did not go through court battles. But in Broward County, that was the case, a 22-year court battle. Fortunately for Broward County, the decision was that Dr. Morris would resign his position at Provident and put his name on the suit against the Broward County Medical Association and Broward General Hospital at that time, who were creating the barriers that were not allowing them to get their privileges at the hospital on a catch-22 in essence. In order to get credentialed at Broward General, you had to be a member of the Broward County Medical Association. In order to be a member of the Broward County Medical Association, you had to be credentialed at Broward General Hospital. So it was a catch-22 for these physicians. And earlier, before Dr. Morris came in town, they had begun that battle as early as in their 40s, 49 to be exact. They had begun that battle. But years later, now it's 1959, and they're still going through that battle. And it was not until 1964 when the Civil Rights Act passed, and you could no longer discriminate based on race and other factors of a person. That battle became a victory for now the Fabulous Six. And Broward General pulled out of that particular lawsuit. And they had to because, Medicare was passed, and in order to keep that funding in place, one had to abide by the law. And certainly North Broward Hospital District was not going to be going against the law in any means with any court battle. And luckily for the physicians at that particular time, and under the leadership and the sacrifice that Dr. Morris made, the judge and the courts actually sided with the physicians, and they were granted the ability to become members of not only the Broward County Medical Association, but also to get credentialed at the hospitals. And if nothing else, when I say Dr. Morris was a hero, because he made the ultimate sacrifice coming in as a new physician. He relinquished his position at Provident. He worked for Dr. Mizell in Dr. Mizell's office as family medicine, which was ideal for Dr. Mizell because Dr. Mizell, his office, Dr. Mizell was actually a surgeon, but he also did family medicine too, because like many of the doctors, they all had to treat everybody, regardless of what, the specialty was needed. And that worked out for Dr. Morris until he got his own office, and he too remained in Broward. And from that point forward, more and more physicians began to come into Broward County. I remember when Dr. Brown left, the pediatrician, Dr. Brown left, Dad was also doing children, pediatrics. So, when you deliver the babies, mommy brings the baby to Dad's office as well. And he didn't stop doing pediatric care until another Black pediatrician came into town, and that was Dr. Haywood, Arlene Haywood. And he began then to refer all of his children, his babies that he delivered, and he delivered well over 6,000 of them to Dr. Arlene Haywood, whose practice began to soar with referrals from Dad. So now that there was a pediatrician in town, he could refer that and get rid of the peds business out of his office. He did not stop his OB practice until another Black OB came into town that could take over his patients as well. It was very hard for Dad. And certain specialties were trying to even get physicians to cover for them so that they could actually take a break, a vacation, and have a life as well. So when the second OBGYN person came into town, Dad had now some resources where he could not only help get coverage, but could share the load of work in delivering babies throughout Broward County. So all of these doctors, whether when I say progressive visionary men, they were very progressive and visionary men who made a way and paved a way for all of the other doctors who finally came into Broward County. And for that, we are so very grateful that they stayed. They developed a healthcare delivery system that was quality care, providing with the resources that they had at that time. And they hung in there until they were able to realize and get their privileges at other hospitals, and therefore expand their care and the opportunities for their patients and resources for their patients in the delivery of care throughout time. And for that, we are grateful.
So Jasmin, I wanted to ask for the layperson, when you say credentialed, what exactly does that mean?
Well, a physician would have to go through a process of being credentialed at an institution, a hospital. They would have to provide the documentation that they are qualified to be on that staff. their credentials, meaning their medical education, their residency, all of that is reviewed, validated, and they are interviewed and could meet criteria for a hospital to become a physician on staff at that hospital. And so there are different vettings that are done to ensure that the physicians that you are bringing on, especially by specialty and the types of procedures that they can do in your hospital, you go through a credentialing process. It's a very awesome process, but it's one that has to be done to assure the quality of the care that's going to be delivered by that physician in a hospital setting.
So is credentially getting credentials, is that different from being licensed by the state? How does
That's
that
in
work?
addition to. So you have to be a licensed physician anyway. And then you present your application and all your backup documentation to ensure that you meet the criteria for the specialty that you wish to practice in that setting, in that hospital setting. And then all of the other rules and regulations whereby the staffs of the hospital have to maintain while they're in credentialed and a staff member of a particular hospital.
So, so the original Fab Five, they were licensed, so they come into town, they one at a time, adding to the staff at Provident. They're all licensed physicians. They're doing this amazing work, but they can't get credentialed because they couldn't. That could only happen at the other hospital, you were saying.
Right. They could not get credentialed at Broward General. There were other hospitals later on down the line in the North Broward Hospital District and the South Broward Hospital District, and other hospitals as well. There was Holy Cross that came in much later, Plantation General that came in much later. But in those early days, it was Broward General here in our area, Memorial down in the South area, Jackson Memorial in the Miami area, in Palm Beach County, St. Mary's in the Palm Beach County area. So there were different hospitals across the South. But during those times, remember, we're talking 38. We're talking, Broward General was opened in February of 38. So we're talking the days of segregation. And Broward General was a private hospital at that time. It was not the North Broward Hospital District at that time, a tax assisted hospital. It was not that at that time. That didn't happen until I believe 1951. Hospitals had their rules on who they brought in as staff. And let's just put it frank. Broward General at the time was an all-white hospital. Broward County was segregated. Very much so, very segregated. Provident was the only resource for Black and Brown, African American in particular, Black and Brown communities in Broward County at that time.
So basically, that's the way, because they couldn't go get credentialed, what you're saying. Now that would prevent them, exclude
Right,
them from
they were
being
not
physicians
members.
there.
Right, they were not members of the Broward County Medical Association, which was one of the rules at that time, that in order to be credentialed with your applications at the hospitals, you had to be a member of the Broward County Medical Association. And at the time, Broward County Medical Association was also all white.
Gotcha.
And therefore, it was a catch-22 for the physicians because they could not become members of BCMA and therefore could not present applications to get accepted for credentialing and to become a part of the medical staffs of the hospitals.
Wow. And all of that was a battle until the mid 1960s, basically.
Yes, and when the Civil Rights Act passed, it became illegal to discriminate, it became illegal, period. That was the law, and the law said you could not do that, and therefore now they had an opportunity that hopefully, with the courts siding with them, which they did, and people backing off because now it's the law, that they could present their applications for both organizations and be on the same playing field and be given the opportunity to stand and present their applications for credentialing at the hospitals, which they were able to do.
Wow. Wow. Was there
Very
a
much
similar?
different from what transpired down in Miami at Jackson Memorial Hospital. Those early physicians there, Dr. Simpson and others, Simpson, Green and others, um, they didn't have to go through a court battle to get credentialed and become staff physicians at Jackson Hospital.
So Miami back then was very different from Broward County.
Oh, yes. In terms of the healthcare delivery system.
Wow.
There was still segregation in Miami as well, but in terms of that healthcare delivery system, those physicians did not have to go through a court battle over the number of years. It took 22 years for these guys to over a number of years to get credentialed at a hospital.
Did the nurses endure similar kind of difficulties getting licensed?
No, you had to get your license in order to practice in the nursing field. That wasn't the issue. But at that time, none of those hospitals were hiring Blacks as well. So the only places where those nurses were going to be working was at Provident Hospital.
No.
Until the others began to actually employ Black nurses.
Wow. Wow. Well, a lot to digest there. I appreciate you educating me and us, our audience, on this. Any other thoughts? Any other thing you would like to share with us about this amazing history of these trailblazers? I mean, unbelievable.
Every year, if we look at Broward County, there is so much rich history here. And if we just take the time to truly appreciate the sacrifices that people made in those early days, it amazes me as a child growing up and knowing these men, all 6 of them I knew. I used to keep Dr. Morris's children, babysitters. Dr. Sistrom was my godfather. Dr. Mizell's daughter, Deborah, was my babysitter. Gwen Bass, the daughter to Dr. Bass, was another one of my her mother was my godmother. So to know these families and to know these men and to know what they sacrificed just to be able to deliver the healthcare to the people that they served, and to do that in a county as rich as Broward County is, and to have to struggle to do that, people have no clue as to the sacrifices that they made and their families made. And it's come full circle now where we have so many physicians here, and they could really appreciate the history of what it took for the first to be able to pave the way for them. Is an astounding bit of history that needs to be preserved.
Well, hopefully this interview will do a little preservation, something that we can continue to educate the children on, and very important.
Thank you very much, and thank you for putting this part of the history, because there's so many people that try to rewrite history into a way that makes it feel better for them, but the truth is the truth, and you can appreciate the truth and then see from how far we have come. And it just amazes me when I think about what these doctors in particular did to pave the way for others who would never understand what they had to go through.
Wow. Well, thank you again, Jasmin. I appreciate it.
Thank you very much.
Very grateful. And to our viewers, thank you for spending some time with me and Jasmin, who was the star of the show and really educated us. Thank you again.
Thank you.